Welcome to episode 2 of Mindfulness Mondays, a Virgin Islands Department of Health conversation about mental wellness. I am Dr. Chatal Noel, Director of Behavioral Health, and joining me is Zulima Webster, licensed marriage and family therapist who serves as our state prevention coordinator. The COVID-19 pandemic affected us in more ways than one. It strained relationships and in many instances isolated us from our loved ones, co-workers, friends, and schoolmates, leading to increases in loneliness, anxiety, and depression. Now that COVID-19 no longer qualifies as a global health emergency, how do we find relationships that are meaningful? Tonight, we will discuss building the foundation for healthy relationships. Some of the consequences of COVID-19 was that it changed our perspective on how we manage our lives. For instance, the importance we placed on our occupations, leading to the Great Resignation. It also revealed a lot about how we manage relationships. So good evening, Zulima.
Good evening, Dr. Noel. How are you?
I'm well. To start our conversation, I would love for us to discuss and just define what a healthy relationship actually entails, because we know it could be defined many ways by many people. So what would you call a healthy relationship?
Well, first and foremost, I think a healthy relationship starts with two healthy individuals. So being healthy yourself, finding what that means to you, but also as you become a couple or enter into a relationship, being able to be kind, compromise, build trust, communication. There's so many different aspects. It's all about like really and truly what feels healthy to you. I think an important part of that is also healthy autonomy. So autonomy being like a sense of independence, you being yourself, able to make yourself happy, and then making a connection with another person and building on that. So really and truly not like looking for your happiness in someone else.
And I think it's important that we define relationship as not just romantic relationship, right?
Yes.
So we're speaking about sibling relationships, parent-to-child relationships, and even some of the non-traditional relationships, even polyamorous relationships that we're talking about, that is very individualized, but there are some common factors, such as, like you said, honesty, communication, whole individuals communicating with each other. A conversation we have at the department all the time has to do with health equity and access to care. So I would love for us to jump into the conversation about protective factors and how healthy relationships can actually serve as a protective factor in health.
Okay, so how can healthy family and romantic relationships improve overall health?
Absolutely. So healthy relationships in general, and again, talking about all relationships, is a springboard or a model for how we deal with, for example, traumatic situations. When it comes to stress responses, if we see someone who we are able to be supported by, have a great conversation with, who we get great feedback from, we see individuals who are less likely to engage in risky behaviors, individuals who are more likely to open up about what's happening with them, less likely to receive a mental health diagnosis, less likely to engage in risky sexual behavior, individuals who are less likely to use alcohol or substance use in order to navigate whatever difficulty or challenge they're experiencing. We have individuals who have greater social competency, just being able to understand someone or approach even a stranger and have a conversation without the fear of what the retaliation is going to be. Individuals who feel happier and way more satisfied with life. So healthy relationships isn't just about you and I or two individuals interacting in a silo. It breaks out to all the relationships we have with other individuals.
So I'm glad you mentioned that. And so I would like to know your opinion. How do we know a relationship is worth saving, even if we experience challenges? And that's in terms of a social relationship, like a relationship between friends, romantic relationship, family relationship. A lot of us experience challenges with family members. So how would we know the relationship is worth saving?
Well, first, I think we have to speak to conflict. We have to ensure that all of our relationships that have conflicts in them, that we analyze if it's a conflict that we actually want to work through. If you're able to approach another individual and say, this is bothering me, this is how something made me feel, and that person actually listens to you, takes the time to adjust their behavior, that relationship may be worth saving. Something that you said earlier, you talked about communication. Communication, we have to stress, is bi-directional. It's not just you listening and me absorbing what you're saying and changing my behavior. It's also us having a conversation. So me listening and you telling me exactly how you feel. So those are key aspects of a relationship being healthy and being worth saving. There's also the foundation of repercussion in relationship. Very often there's a consequence to me speaking up. There is a physical consequence, an emotional consequence. And it's not just the addition of a consequence, it's taking away affection, taking away items if we're talking about parents to children. There may be consequence to behavior, but there should not be consequence if I'm just voicing how I feel to you in a healthy way. We have this belief in our culture, especially with our children, that they should be seen and not heard. And that can't go against the backdrop of what our children are now experiencing, where they're comfortable having certain conversations. We want to make sure that we're massaging our familial relationships and our friendships as a great foundation for our romantic relationships later on. What we grow up and see is often what we continue in other generations. So either we're going to continue what we see, or we have to be the one to break things that we did not like growing up.
I love that.
And on that note, we'll go to a quick commercial break.
We grow food to feed our community and to keep us healthy. Eating a healthy diet is important for good health.
Eating fruits and vegetables makes us go stronger.
Eating healthy is easy. There is an abundance of locally grown produce and livestock you can enjoy.
Your meal should be colorful with lots of food like spinach, pumpkin, and tomato.
Sliced raw fruits and vegetables make a healthy snack.
Local nuts, beans, lean meats, and fresh eggs are an excellent source of protein.
Limit the amount of sugar and salt you consume, and choose whole grain options when eating pasta, bread, and cereal.
And make sure to get moving every day.
We can all help each other live healthier lifestyles. Support a local farmer today for fresh local food.
This message was brought to you by the Virgin Islands Department of Health, Division of Chronic Disease Prevention, and the USVI Cancer Coalition.
Welcome back to Mindfulness Mondays, where we're talking about healthy relationships. So, Zalima, what advice would you have for dealing with conflict in a relationship?
Okay. First and foremost, conflict is always going to exist in any relationship, romantic relationships, friendships. However, effective communication. I cannot stress communication enough and learning how to communicate effectively. And people think by just engaging is communicating, or by starting a conversation means effective communication. Like, oh, well, we talk every day, so I communicate in. That's not the case. So in effective communication, you use iMessages to express how you feel. There's also active listening involved, which is listening not to respond, but listening to understand. Also, a big part of effective communication, paraphrasing. If somebody speaks to you or is engaging and expressing how they feel, you being able to say back to them, okay, I'm hearing you say, is this what you mean by that? So I just heard you say, did you, is this what you were trying to say? Or is this how you feel? I just want to understand. I want to ask you so I could have more understanding. So having that, back and forth of just trying to understand as much as possible is what's helpful to dealing with conflict. Being able to not having to agree with how somebody feels, because really and truly a feeling is not a fact. So you don't have to agree with a feeling to understand or validate that feeling. So just having the respect to understand somebody might deal with conflict different and might need time to process information before responding. So also respecting someone's space and even timing that space. So if someone says, I need space or I need time, give me maybe an hour or give me until the end of the day before I could respond. Actually respecting that and not expecting the person to respond to you immediately because you have a need, but respecting somebody's boundaries. Also in your communication, not using blaming language or definitive terms such as always or never. So just isolating the issue as, this is how this situation caused me to feel. Not you always this or you never this, because that could cause somebody now to want to be responsive in a negative way.
So there are a lot of myths that go with healthy relationships or relationships in general. First off is those steps are easy. I would say that's the number one myth. Having conversations starting with I statements has never been how especially Black and brown communities communicate. We feel as though the louder the person is, the more right they may be. So exercising things like I statements or this is how you made me feel, taking that break or that pause in between conflict, sometimes we just don't engage in that. So that's the first thing. Some of these steps are not going to be easy, but just with any other practice makes perfect, right? Any other engagement, basketball, tying your shoes, going to the gym for the first time, practice makes perfect. Over time, I also want to, or in reference to what we said earlier, children should be seen and not heard. That is a cultural belief that we have deep-seated in our culture, where children should be in the room, not running around, not expressing themselves, not being in grown folk business. That's something that we say all the time. But when children are seeing these things, they're also learning these things. So if they see us yelling, they're learning how to yell. If they see us not even engaging in conversation, because sometimes as parents, as caregivers, we feel that if we don't say anything, then we're doing a justice to our children by not having those more difficult conversations. And we know that's not true. They're just learning to internalize how they feel because it's not a safe space. Another common myth is that we have to exercise psychological safety. So we talked about that in our last episode, and I do want to bring it back and kind of keep having that conversation because we represent a safe space and we can represent a safe space, whether it's to our spouses, our friends, our co-workers. Sometimes people come to work with so much on them and we assume that they don't want to talk to someone because it's all about work. You may be the only safe space for that person. So it's a common myth that, that person doesn't want to talk to you if you just ask, how are you actually doing?
That's very true.
Absolutely. And I would say codependence.
Yeah.
There are times that we see relationships that we would consider to be codependent, meaning that those individuals are not actually individuals. We just know them as a couple. They have the same Facebook page. There's one phone number to reach them. And they take all these pictures together, they take all these trips, and on the outside, we look at those relationships that's so healthy. I want to model that relationship. That does not necessarily mean that that relationship is actually healthy. In fact, that could be a domestic violence relationship. We don't know on the outside looking in. So it's important to focus on your relationship and what's healthy for you, because for some relationships that is healthy. They have worked through whatever conflict they have. They are able to be a united front. They are able to talk about the difficult topics behind closed doors. And when they're in public, they present a united front. For other people, like I said, that might represent a domestic violence relationship because there is no independence in that relationship. So we have to make sure that we're not just mimicking or being jealous of what we see in public, and focus on the relationship that we actually have within ourselves and heal our own wounds and not look at someone else's relationship.
Right.
I'd love to ask you for some advice because you are the licensed and marriage family therapist, right? So what advice would you give to couples who are actually struggling to maintain a strong connection in the face of a challenge such as long distance?
I would say, as it relates to long distance relationships, a lot of us, we tend to stray away from that. Some people are like, oh, that's not me. How do you do it? Right. Or how's it done? I think trust, compromise, obviously communication, and not being afraid to schedule. Right. Not being afraid to say, oh, well, this is my schedule. Let me switch this around. If this is your schedule, this is my schedule, then this is where we have the most time to, some people do FaceTime dating, and even schedule romantic situations or intimate situations via FaceTime. We have so much technology now that it's easier to have a long distance relationship or a non-traditional relationship. So another thing that is essential to those long distance relationships is making sure that your goals align. So when I say communicating, not just talking every day, seeing each other, FaceTime, what did you eat today, good morning, and those types of things, but actual conversations about your goals, making sure you're on the same page, because sometimes people have to have those non-traditional relationships for financial reasons. Absolutely. And it's like, it's not that I don't love you, but I have to go here so that I could provide, and but I also don't want you to have to give up your goals and your job and what you're doing and have to follow me. So let's see how long we can make this work until we come up with a common goal.
Right, absolutely. And something I want to add to that is the fact that people change. I think when we get into relationships, there is this understanding or this belief that an individual is going to stay the same forever. And that is not true. People grow, people adjust. Sometimes finances come into to play that weren't there before. So you may get laid off, and now the person who was used to having a partner may now have to be the only breadwinner. Or there may be a difficult pregnancy, and now you have to be on bed rest. So the fact that life circumstances happen, but also personalities tend to evolve over time. And having couple check-ins to say, hey, I noticed that you don't do this anymore. Can we talk about why you don't do that and how it used to serve me in our relationship?
So true.
Yeah. And I want to talk about, just to engage in what we actually do day to day when it comes to mental wellness and mental health diagnoses. Is it possible for someone with a mental health diagnosis to have a healthy relationship?
For sure. Definitely. So when you mentioned before two whole healthy individuals coming together to have a relationship, and you also mentioned polyamorous relationships earlier, so even more than two whole healthy individuals getting together in to form a relationship, that is having a mental health challenge, and especially as related even back to COVID-19, a lot of people experienced mental health challenges as a result, because a lot of people lost family members, and it was very unexpected during the pandemic, and so people were grieving, people were depressed, suffering from depression, people were losing their jobs, so also suffering from anxiety and depression. Definitely, should I go out and socialize? Is it too soon? Do I still wear a mask? Do I take off the mask? Is it safe for me to be back at work? I'm a first responder, so I have to be back at work. But having that anxiety, even of bringing it back to your family, people wanting to travel, people wanting to see loved ones, but even feeling the anxiety of like, oh, let me make sure to tell them I'm vaccinated. And that my last COVID, having to like have these things almost on your forehead, right? To communicate with people. That was very, very high anxiety. And I think sometimes people don't put labels on mental health, like we're calling it mental health challenges, because we don't want to call it mental health diagnosis. But it's very easy for us to say, oh, my throat hurts, let me go to Dr. Prasad or whoever and find out, you know, do I have strep throat or is this just allergies? Right? We want that diagnosis so we could know how to treat it.
Absolutely.
But when it comes to mental health, we're afraid of being labeled with a diagnosis. We're afraid of knowing exactly what it is. But awareness is the biggest and most important thing to being healthy. Being aware of who you are, what's going on with you, what you're feeling, because that's the only way you're going to be able to express it appropriately to the people you love so that they could support you in the way that you need them to. So I definitely feel like having mental health challenges and being in a relationship and being in a healthy relationship is possible once there's awareness and communication as well as treatment.
Absolutely. So it's about knowing your triggers, knowing what you're diagnosed with, and knowing how not only does that affect you, but those around you.
So true. So how do you feel our culture affects healthy relationships?
I think it has a lot to do with messaging. So we've spoken about some of the risk factors or things that could lead to poor relationships, such as children should be seen and not heard. But I didn't talk about how our culture actually serves as a protective factor. We are a familial culture. We stick together through thick and thin, even if some of those relationships may not always be healthy. So knowing that family is really, really important to us, I think is a cultural message we should definitely keep. Also, we need to get back to family dinners. So when I was growing up, my grandfather constantly made us sit around the table, eating with a knife and fork to be proper. And there was no TV, there was no radio. We had to go around and talk about what our day looked like. Him doing that when I was so young, in such a formative age, made me feel like I could speak about what I was going through as a child and somebody would listen. So it's not just about having somewhere to speak, but someone would listen to you and be supportive of your challenges. And I also got to hear what adult challenges sounded like. So things like, oh, I have an appointment coming up and I'm scared about what the result is going to be. Or, I have a big test coming up to get into college and I don't know whether or not I'm prepared, and just self-esteem challenges. So it was really important for me growing up and being comfortable in multiple spaces with individuals of different age groups to have that as my foundation for healthy relationships. My father also talked about secrets. And he would always say, this family is not a family of secrets. If someone's going through a challenge, we need to talk about that openly. So that was a great formative space for me. And I think culturally, that space still exists. We just kind of need to get back to it.
Absolutely. I'm so glad that you said that, because I feel some families have strayed away from that, and there are a lot of secrets in families. So being able to communicate more and share things with your children. I always tell my clients, don't be afraid to cry in front of your children. Do not, if you're grieving, grieve in front of your children. Do not think you have to hide your children from your own human emotion. Because then they're going to turn around and hide their emotions, So as a parent, your child needs to see how you act when you're distressed. Your child needs to see that you're capable of crying, meaning it's okay to cry, and just being able to communicate, and that also boosts self-esteem of children, allowing them to have a voice, allowing them to be a part of a conversation does wonders for a child's self-esteem and allows them to be able to know how to communicate effectively and assertively. This is a need I have. This is how I feel about this. This is how this made me feel. Being able to create that space where everybody is allowed to communicate how they feel, even if the situation is not immediately resolvable.
And everyone gets to brainstorm together. So it's that supportive atmosphere, bringing the family together for a shared goal.
Right.
On that note, we will be right back.
We grow food to feed our community and to keep us healthy. Eating a healthy diet is important for good health.
Eating fruits and vegetables makes us go stronger.
Eating healthy is easy. There is an abundance of locally grown produce and livestock you can enjoy.
Your meal shall be colorful with lots of food like spinach, pumpkin, and tomato.
Sliced raw fruits and vegetables make a healthy snack.
Local nuts, beans, lean meats, and fresh eggs are an excellent source of protein.
Limit the amount of sugar and salt you consume and choose whole grain options when eating pasta, bread, and cereal.
And make sure to get moving every day.
We can all help each other live healthier lifestyles. Support a local farmer today for fresh, local food.
This message was brought to you by the Virgin Islands Department of Health, Division of Chronic Disease Prevention, and the USVI Cancer Coalition.
That was a great conversation. Thank you, Zulima.
Thank you.
Thank you for joining us for our second episode of Mindfulness Mondays. Many thanks to our behavioral health staff for all the work you're doing throughout the territory to change the narrative regarding mental wellness. In every relationship, what is for you will only bring out the good in you. Don't be afraid to voice your needs, your boundaries, or your goals. Be open to receiving love, but first be sure to love yourself. We'll see you next Monday, same time, same place, for another episode of Mindfulness Monday. But before you leave, please enjoy this Mindfulness Minute with Amanda Armstrong, yoga instructor.
Hey guys, my name is Amanda Armstrong, also known as Yogi Mandi, here for a Mindful Minute. Today, let's place both our hands on our heart space. Feel free to close your eyes. Start to notice and feel your heartbeat. Let's take a big breath in and a long breath out. Fully arriving here into this present moment. This time, let's inhale lots of love and exhale lots of love. Expressing love to yourself in this moment. Let's inhale, open the arms wide, then exhale, give yourself a nice big hug here. Feeling your own embrace, maybe rocking side to side. Let's inhale, open the arms again, then exhale, switching the other arm on top this time as you give yourself another big hug here. To love and accept yourself just as you are. Remember to love yourself first. It certainly makes it easier to love others.